Assalamu alaikum. Today we are going to read AKB clinical case number 12, that is a 3-month-old girl with diarrhea. Here is the overview of the case. We have a 3-month-old girl who presents with irritability, vomiting, and recurrent loose stool that are sometimes blood stained. Right away, these symptoms are concerning and we need to narrow down the possible causes. She was born at term weighing 3.5 kg, which is a healthy weight. However, her current weight is 4.9 kg, placing her on the 9th centile. This suggests faltering growth, meaning she is not gaining weight as expected for her age. Her feeding history shows she is being largely breastfed with occasional formula feeds. This is an important detail because it helps us think about what might be triggering her symptoms. When we examine her, she looks clinically well, but she is irritable when handled. She has small eczema patches on her arms and legs, which suggest an atopic tendency. Her abdomen is soft, but there is perineal redness likely due to frequent loose stools. Here asked first question is, which of the following is the most likely diagnosis? Select one answer only. Options are congenital lactase deficiency, cow's milk protein allergy, eosinophilic esophagitis, gastroesophageal reflux, and Meckel's diverticulum. So the most likely diagnosis based on her symptoms and history is cow's milk protein allergy. Now let's systemically evaluate why cow's milk protein allergy is the most likely diagnosis and rule out the other options. Cow's milk protein allergy is an immune-mediated reaction to proteins found in cow's milk. It is the most common food allergy in infants and young children. It affects up to 7.5% of children in the pediatric age group. In studies where cow's milk protein allergy is confirmed by food challenges, the incidence is about 1% among UK children. Most cases occur before 6 months of age and rarely after 1 year. Symptoms often appear after the introduction of formula or solid foods, especially in partially breastfed infants. Cow's milk protein allergy has a variable clinical presentations and symptoms may involve vomiting, loose, bloody or mucousy stools, colic, poor growth, and coughing, wheezing, rhinorrhea, eczema, urticaria, and in some severe cases, anaphylaxis, which can include acute airway obstruction, wheezing, and cardiovascular collapse. There are two types of cow's milk protein allergy based on the underlying immune mechanism. Number one, IgE mediated reaction, that is immediate hypersensitivity. It shows symptoms within minute to 2 hours after ingestion of cow's milk protein. Common symptoms include swelling of the lips, tongue or eyes, sneezing, coughing and injectable redness. In severe cases, it may cause anaphylaxis. Diagnosis involves skin prick testing or measuring IgE levels. Number 2, non-IgE mediated reactions. It shows delayed symptoms and may appear hours to days after ingestion. Typical features include vomiting, colic, loose bloody stools, anemia, commonly diagnosed by exclusion and improvement after elimination of cow's milk protein. Let's rule out other causes. Congenital lactase deficiency. It causes an inability to digest lactose, leading to severe diarrhea and dehydration immediately after birth. Symptoms include watery diarrhea, bloating, and failure to thrive from day one as lactose is present in breast milk. This baby has been breastfed for 3 months without significant issues until now. Her symptoms point to inflammation or allergy rather than lactose intolerance. So, as this condition would present from birth and lactose intolerance does not cause eczema or blood-stained stool. So, it's wrong. Next is eosinophilic esophagitis. This rare allergic condition is more common in older children and causes vomiting, food refusal, feeding difficulty. It may present with faltering growth, but blood-stained stools and eczema are not typically present in it, so it does not fit within this case. Next option is gastroesophageal reflux. It commonly present with vomiting and irritability, especially after feeds, due to stomach acid flowing back into the esophagus. However, it does not cause eczema or bloody stools or faltering growth, which are prominent in this case. Unlikely, as it cannot explain all the baby's symptoms. Next option is Meckel's diverticulum. It is a congenital condition that can cause blood-stained stools, but it does not cause vomiting, irritability, or eczema. It is a rare diagnosis in comparison to cow's milk protein allergy, especially in this age group. Second question is, which of the following milk formula is initially most appropriate in this case? Select one answer only. Options are amino acid based, extensively hydrolyzed cow's milk, goat's milk based, lactose free, and soya based. So let's rule out one by one. Amino acid based formulas are used in severe cases of cow's milk protein allergy when symptoms persist despite using an extensively hydrolyzed formula. They are highly specialized and expensive, reserved for second line treatment. Not needed as first line treatment in this case. Next option is goat's milk based formula. These are proteins in goat's milk are very similar to those in cow's milk. So infants with cow's milk protein allergy often react to them as well. So it's not recommended due to high risk of cross reactivity. Next option is lactose free formula. These are used for lactose intolerance, not in cow's milk protein allergy. Cow's milk protein allergy is caused by an immune reaction to milk protein, not lactose. Next option is soya based formula. Soya based formulas are not recommended for infants under 6 months because many babies within cow's milk protein allergy are develop cross reactivity to soya proteins. So it's not suitable for this age. Thank you for watching. This is all about from this case. If you have any question or any suggestion, comment below or you can email me on this given ID. Till then, Allah Hafiz.